Hi there, I'm Joe Ty, and this is a message for the leadership team at Augusta Health. I am really looking forward to joining you on February 28th for your leadership program. I've been thoroughly impressed with what I've learned about your organization thus far. So a little bit about what I'm going to cover and a bit about me first. I started my healthcare career back at the University of Iowa Healthcare back in the mid-'80s. I was responsible for emergency medical services, and it was a very exciting time. We were in the early days of helicopter transport, paramedic training, regionalized communication systems. I left UI to go to business school at Stanford, where I got my MBA, and after that returned to the hospital world for about 8 years. Ended my career as Chief Operating Officer of a very big community teaching hospital. And for the past 25 years, I've been working with hospitals and health systems on values and culture as a consultant, a trainer, as an author, as a speaker. And the primary focus of my work, has been on why you need to move from a culture of accountability to a culture of ownership. See, accountability is externally imposed motivation. It's the top-down hierarchical reward and punishment that incentivizes people. Ownership is a much higher level. It comes from the internal pride and commitment and professionalism to doing the best you can, to taking ownership for those goals and for those results. And I've got two guiding insights behind all of my work that I've learned over the past quarter century. And the first is this: because culture is shaped by the collective attitudes and behaviors of the people who work in an organization, culture will not change unless and until people change. The second insight, though, is that people are resistant to change, and people will not change unless they see it's in their own personal interest and they're given new tools and techniques, because we've all tried to change and failed. We've got to try something new. And so a lot of my work is focused on how do you inspire people to make those personal changes that you have to see made in order to create a culture of ownership. And that's my intention on February 28th, is to challenge your team, your colleagues, your leaders, to make those personal changes in a way that will inspire the people that work for them, all 2,000 plus of your colleagues, to start thinking like owners. Let me wrap up with what I think are the most important 3 words in my book, The Florence Prescription. Proceed until apprehended. And I say that because, number one, that was really Florence Nightingale's attitude about getting things done. And number 2, it really does capture the spirit of a culture of ownership. And it means 3 things. 1, if something needs to be done, do it. You don't walk by a piece of paper on the floor. You don't walk by a patient room where they're calling for help without walking in and at least seeing what you can do. 2, if you need help, ask for it. You know, there's so much learned helplessness, so much resistance to taking action. And a proceed until apprehended mindset helps people overcome those inner barriers. And 3, if you do get apprehended, don't just take no for an answer, plea bargain for a better solution. Because the reason you took action in the first place is something needed to be done. So I'm looking forward to our call in preparation for February 28th. That will help me further refine what my comments will be and how I can best help you. My plan, as I told Mark, is to be there for the entire day so that by the time of my wrap-up keynote, I'll be able to tailor my comments more effectively to the goals that you've talked about during the day. I will see you then. Thank you.